January is Glaucoma Awareness Month. It's a blinding disease. Premier Eye Care has been providing eye care services to the Central PA area for 40 years. Dr. John O'Donnell is here today to educate us about glaucoma. And I understand, Doctor, you're one of only 5 glaucoma diplomates in the world. What is that?
A glaucoma diplomate is a diplomate of the American Academy of Optometry. We go through a program to get extra expertise in glaucoma. It took me about 5 years to go through the program, and there are 4 in the U.S. and 5 worldwide.
So again, one of only 5. That's so interesting. And I noted that glaucoma is a blinding disease. Can you talk about, what it is and also its prevalence?
The best way I can describe glaucoma is if you think about your eye as a TV camera, a video camera.
I can do that.
and the TV is back here in your brain, and it's connected by a cord. The TV camera is connected to a cord. That cord is called the optic nerve, and instead of being made up of copper wires, it's made up of about 1 million to 1.5 million nerve fibers. When nerve tissue is damaged, as you know, we don't have the ability to repair it. So any damage to those nerve fibers is permanent, and if you have enough, you'll result in vision loss. Glaucoma is a disease that even to this day, we don't truly understand how it works, but the end result is it winds up damaging the optic nerve. So it is a form of optic neuropathy. It is treatable, but if it is not treated, it will result in vision loss, visual disability, and eventually blindness.
But it gets tricky, right? Because you don't often have symptoms until it's progressed.
That's correct. As I said, there's about 1 million to 1.5 million fibers in the optic nerve, and there have been papers published that show that you can lose up to half of those fibers before you begin to experience visual symptoms. So it's often called the thief of sight because people are not aware that they're losing their vision. The other thing is that glaucoma is typically an asymmetric disease, so it affects one eye more than the other, and I've seen many times where a patient is unaware because although they've lost significant vision in their one eye, the other eye's covering for them.
Interesting. So encourage us, though. Talk about prevention.
The main way to prevent losing your vision is by getting your eyes examined. There are really 3 reasons why people go blind from this disease. And as I said before, glaucoma is not very prevalent. It's not a prevalent disease. It only occurs in about 3% of people in this country, but it is the leading cause of irreversible vision loss both in this country and worldwide. And there are 3 reasons for that. Number 1 is people do not get diagnosed. And the main reason why people do not get diagnosed is because they don't get their eyes examined. And that examination is not an examination for glasses. To do a thorough eye examination for glaucoma involves having your eyes dilated. Most people are familiar with what they call the glaucoma test, which is getting your eye pressure checked. The pressure in the eye is actually no longer considered part of the definition of glaucoma. It is a significant risk factor, and frankly, the only risk factor we can treat, but it is not the disease. Again, it's a disease of the optic nerve. So just having your pressure checked or having a normal pressure does not leave you off the hook from having glaucoma.
And then just quickly, what are the other 2 reasons?
The second, which is significant, and one which I see every day in my glaucoma practice, is the patients are not compliant with their medicine. And again, there's multiple reasons for that. One is the cost and the availability of the medicine. The other, frankly, is dexterity. A lot of my patients are older and they have difficulty handling the bottles. And then the last is that they don't perceive the danger in not being compliant with their medicine.
And then, excuse me, I don't mean to interrupt, but we're running out of time, so I want to mention, the 3rd reason is just the doctor maybe not being as aggressive.
Not being aggressive in managing their disease.
No, of course, you are aggressive, one of 5 diplomates in the world. Let's put up the information. I mean, one of 5 in the world, and you're located right in the Harrisburg area at Premier Eye Care Group. Thanks so much, sir.
You're welcome.
Very
Thank you for having me. Appreciate being here.
You're very welcome. We'll be right back.